Hi, Louwrens Swart here, a maxillofacial and oral surgeon from Cape Town in private practice. I have been fortunate to use the new tissue-level Straumann implant, the TLX. These implants are easy to restore and have the same root structure as the BLX implant. The prosthetic platform, easily restored, will not reflect the surgical challenges that had to be overcome to achieve consistent, predictable prostheses. In edentulous cases with a composite defect, the clinical routine and workflow are easy to follow and routinely completed with immediate loading. The larger bone-to-implant contact and simplicity of the tissue-level prosthetic interface is a game changer. And clinical challenges such as thin ridges and soft bone can be overcome by the wide range of implants available. A combination of BLX for aesthetic and angular indications and the TLX implant will be the future to simplify edentulous dental implant reconstructions with immediacy and satisfaction of the patient in mind.